welcome everyone to VesCELL Health Talks. The real key part of today, and which I think makes this the most important one yet, Howie, is having you on to share your background. I'm going to walk us through a couple of slides. Thomas, would love for you to jump in anytime with your point of view. We're going to go through your piece, Howie, and then we're going to talk about our care, how we provide it, what's involved, how to get it, and then we're going to go into Q&A. We do have other patients on the call. I hope they will chime in with questions. We invite physicians to join. We invite our investors. We invite regulators. What I love about this group is our total transparency as what we think is one of the key success factors. There's a lot going on in the stem cell industry overall, in the regulatory environments, and then our ability to bring a unique novel care to market and through our clinical studies. Okay, so let me just pull up the slides and we're going to dig in and we're going to have a really great session here.
Cool.
Okay, my friends, here we go. VesCELL Health Talks number 8, focus on patient stories. About VesCELL, patient, Howie, this will be you, and then some Q&A.
Okay.
The background here for anybody new to the call is our unique vascular health platform. So Hemostemix, based in Canada, publicly traded, an autologous stem cell company, developing a commercialized VesCELL, ACP01. So that's at www.vescell.health, covered by 90 patents, over 20 years in clinical development, offered globally, and now in Florida. We're going to cover what that means in peripheral arterial disease, chronic limb-threatening ischemia, also ischemic cardiomyopathy, angina, dilated cardiomyopathy, congestive heart failure, and how a lot of that ladders up into pain and our ability to mitigate that potentially, and our clinical trials in progress relative to our CV vascular study coming up, vascular dementia, and then what we've talked about the last couple of times around the brain-computer interfaces, which is pretty exciting. So if you've been on the podcast or the webinar before, you would have heard that. This is our team. Very quickly, I'll just call out Dr. Henderson, who's not here. He gave a phenomenal talk on the science 2 weeks ago. That's posted on YouTube. I hope everyone will consider seeing that. The disclosures are very essential and important. So we are an investigational therapy under development, not approved by the FDA. Access to this therapy is available globally and in some U.S. states. For example, Florida. And there are many other states that are in the queue with legislation that will allow compassionate use or no option care, or the different pathways that make it available, especially in Florida. We talk a lot about that. Informed consent to patients is essential. We're going to cover that in detail in a minute. There may be travel. You should always consult with your physician before seeking treatment. And generally, these are considered out-of-pocket expenses and may not be covered by your insurance. Our foundational commitment to safety, our scientific rigor, and ethical compliance is the absolute foundation of our culture and how we operate and how we act and think every single day. You know, as Florida came online July the 1st, we had to rethink our regulatory strategy and the overlap between global and Canada and US and Florida, and we are untangling that and we're playing that back to our communities and our audiences so we understand the law. We're speaking with our professionals around that and soliciting feedback, but this is the cornerstone of all of our care from a safety and efficacy standpoint. And then in Florida, what does it really mean? And I think it's worth taking a couple of seconds here so that we're absolutely clear. The cornerstone of this, according to the Florida regulation, is number one, the limitations of indications specific to orthopedics, wound care, and pain. You'll see us talk a lot about pain as a common denominator of the indications that we treat. Manufacturing and quality, where we have our FDA certified clean room and registered facilities at Cytoimmune and their state-of-the-art facility in Puerto Rico. We meet all the stringent guidelines per the law. Patient notice and advertising essential, and I will read this. It says, this notice must be provided to you under Florida law. This healthcare practitioner performs one or more stem cell therapies that have not yet been approved by the United States Food and Drug Administration. You are encouraged to consult with your primary care provider before undergoing any stem cell therapy. This notice must be physically displayed in our partner physicians' offices in the specified 40-point font size, and then informed consent, where there will be a consent document to sign. But that really gets to the handshake between the physician and the patient. We're going to talk a lot about that in a minute. I would encourage everyone to take a look at the law. It's interesting. It's encouraging. Why is that law there? Because there is belief in the stem cell community that there may be safe and effective ways and chances to improve and transform care using stem cells safely that goes beyond today's standard of care. And that state regulatory body has agreed that it's worth offering in advance of FDA approval. And I'll just pause there. Thomas, have any comments on your end?
Well, that's great. And Howie's here to attest to exactly that point, that, as one of the early patients within the first 57 of the patients treated, Howie had to go outside of the US to a jurisdiction where regulators understood that an autologous treatment was safe and potentially effective at treating heart disease. And he'll do a great job of explaining his journey. But, today we now have regulators who understand this, have looked at it jurisdictionally in Florida and actually at the FDA. When you review the FDA's roundtable on this subject, you will note that, as we did, that from RFK Jr. on down, the FDA is looking for autologous and allogeneic stem cell therapies and other breakthroughs that can treat the root cause of a condition. And so we are in a sweet spot as Hemostemix, again, with 498 patients treated safely, with 11 peer-reviewed publications, including 7 clinical trials or studies that document the safety and significant efficacy of using VesCELL to heal yourself.
Fantastic. Thank you, Thomas. Okay, we're going to crank through one or two more, Howie, and then we're going to get to our discussion. There is a crisis of ischemic disease in the world, in the United States, and in Florida. Just pulled a couple of numbers. I believe it's 170,000 people in Florida are at risk now of having limb amputation. That number goes into the millions, as 6% of people in America are at risk with peripheral arterial disease. And there's a pretty clear cascade from PAD down to progression to CLTI, then to amputation. And the question is, why is that? And what happens is, we all know blood vessels play a key role in delivering oxygen and nutrients. They remove waste, support immune function. When blood vessels are damaged, that's called ischemia. That happens in the heart, it can happen in the brain, it can happen in limb. And so what's interesting about VesCELL is that our platform that can regrow blood vessels and improve blood can have safe and effective benefits, according to our phase 1 and phase 2 data that we're going to cover in a minute, to help remediate the damage from ischemic disease. So with that, our good friend Howie Lindeman is on. We're very grateful that you're here and part of our family. And may I welcome you, Howie, just to say hello and tell us a little bit about yourself. And let's take a couple of minutes here and get to know each other.
You have a deal. And pardon my gruffy voice since I just kind of woke up. It'll clear up as we go. Can everybody hear me okay?
Yes.
Great.
All right, great. The easiest way for me to start this and to continue this, start this here, but to continue this part of my life is at times over extraordinary, because I look back at when I originally had gotten, and I don't even like to use the word sick, but when I had my first heart attack, I was living in Maui. And so that was 1989, give or take. And I had no idea what happened. I know I felt really weird. I didn't have so-called pain like we see in films, that it doubled me over in the street. It didn't even double me over on the beach that I happened to be on, but it just was a green feeling. And a couple close friends said that I kind of looked green, and I had no idea what was happening. But of course, we go to a doctor and we get diagnosed to the best of the ability of they can, not necessarily being so far away on the island of Maui. But finding the right doctor was very interesting, because I had no idea what was going on. But now, without belaboring the situation of how it started, I look at where I am now at the age of 74, and people say to me on a constant basis, "You're not 74." And I go, "Yeah, I really am, but I feel like I'm in my 50s." And I still scuba dive. I still do most of the things that I normally would do. The only exception is I did have a pretty bad car accident 2 years ago, so my right leg is painful at my knee. So a lot of the bicycling or running and things have been decreased because the knee won't allow me. But as my ticker, as my heart goes, I'll run circles around somebody because I feel so good. And all of that comes through this extraordinary situation I was presented with. And it was a real simple one. It was either we're going to do open heart surgery, which right away scared the pants off me because I don't like what it denotes, and the discussion of adult stem cell therapy, which I didn't know anything about. And so I chose the second. And as my short little video that is online states, I felt different right away. And whether it was a mental state because I had something done for myself or not, I just got better and better and better. And now here I am all these years later. I have said to many people that are facing this kind of a situation, whether large or small. And in fact, yesterday I had a discussion with a close friend of mine in the music industry that is facing open heart surgery. And that was, why don't you look into a physician that handles adult stem cell therapy before you do the surgery? I said, because once you do the surgery, you're not really going backwards to go, oh, now I'm going to try stem cells. Do the stem cell situation. It's going to work, but just in case it doesn't, you can always go back to the regular standard surgery. But the good point is you'll be able to tell the people that want to do open heart surgery, hey, go to the park, go sailing, because you're not going to see me.
Howie, let's go back to when you were a younger man. It sounds like I think you had won a couple of Grammys. You were in a stressful career doing cool things with audiovisual stuff with the Pope and a lot of like amazing rock stars or something. But tell us about that lifestyle and what was life like then?
The easiest way to start that conversation is I used to have a full head of hair. And so when we look at the stress level, yeah, it all went away. I started in the music industry basically 1979, 75 to 79. And I had come back from Canada and I needed a job. And I had no idea. I was studying oceanographic research in college, but funding stopped. And I got a job in New York City as a messenger. Luckily enough in that regard, and I didn't plan on it, I was delivering tapes and picking up tapes to all the recording studios. And I got to know people. And I got to know people extremely fast and extremely well. I got to know the owner, president of the Record Plant Recording Studio, which is one of the major recording studios on the planet, especially in those days. And one of my early clients, if we want to look at that word client, I like to use the word friend, was John Lennon and Elton John. And that was like the beginning of my career that turned into, here it is, still active. I am not retired by any means. In fact, I put a little joke thing up on Facebook recently. It says, I'm not retired. I'm operating on aftermarket parts. And that's how I look at it. Without the situation that I had in regard to adult stem cells, I probably wouldn't be here. I owe it, and I owe my life and my livelihood of being able to continue and work with the people that I do, making the records that I make, and then go on the road also, which is extremely grueling, because if you're sleeping 4 hours a day, you're lucky. And being able to kind of cross my career from a recording studio to the road is a rarity by itself, because there aren't a lot of people that do the crossover thing, because it's two separate sciences.
So
And
how did, sorry, how
yeah,
did you feel as your career was taking off, in the prime of your life, you're
right.
confronted with that health challenge. What did that feel like? And what did that mean? And how did you navigate those decisions? And how are you thinking about making those decisions?
In the decision making, once I knew that something was done to me to better me, and when I say better me, it was because I did something to take care of a health situation that I didn't know I had, nor knew that my grandfather, died of congestive heart failure. So it kind of, great, fell into third hand.
Right.
So when I had the procedure done, I was in my favorite place. A couple days later, it happened to be off US soil, but I was on the beach, and that has always been my escape in a mental and physical place, and a spiritual place for that matter. And the decision of continuing what I do wasn't a decision. I had no reason to stop. I had no reason to go, oh boy, I'm sick, and oh boy, there's something wrong. I can't
Living
continue.
ahead of you.
Yep. And I just hit it, and believe it or not, had more success. The only thing that has slowed me down in this latter day is what we all went through with the COVID period that destroyed a lot of businesses, including the entertainment industry. It just cut it more than half because of what it was. So I'm still active, still finished some recent stuff with Olita Adams, and possibly getting ready to do another tour for a couple months. There's no stopping me. And people say to me, well, when are you going to stop? Or quote unquote, when are you going to retire? And I said, when I croak. Why should I stop prior to that?
Well, Howie, how did you, are you risk averse, or how did you feel like you would be an early patient with VesCELL? In other words, there were only I think back then there would have been a few dozen patients who have taken it. What did it mean for you to take an investigational therapy? Were you worried about it? Did you have clinical data to look at? Did you have a physician to talk to? How did that work, and how did you make that decision to feel comfortable with what you had at the time?
An easiest way to answer that deep question is, yes, I had the medical folks or medical folk to talk to whenever I wanted to, which I did. I wasn't afraid at all, because I knew how I felt. I knew that I was doing something for me. Easiest way to say it, out of the mainstream. I wasn't just another one lining up in the hospital getting what everybody else had. And I think when you hit those numbers a moment ago, for some reason I recollect that I was told I was the 50th person on the planet Earth. And to me, that was exciting, because I was in the forerunning of where this amazing facility, this amazing situation of, I guess, science being health and health being science, instead of the old standby of, oh, cut and stitch, which is what we're so tuned to understanding. There are other ways of doing things. And I'm proud enough to say that I'm one of those. I did something different for me that worked, and worked for a whole bunch of other people, because as my life grew, I would have normal conversations with people, and somewhere along the line, somebody would go, I had that done also. And all of a sudden, that connection to other people grew and grew and grew. And if a week goes by without me talking to at least 2 people a week that either call me or I've known, that conversation comes up again. Not only, how you feeling? Are you going to have it done again? And one of my answers is, I don't need to. I'm doing great. And I am doing great. I feel like a pain in the butt, like I always have been.
And the year that you were first treated, Howie, with VesCELL was how many years ago, approximately?
Okay, my heart attack was, I think at this point it was, if I'm not mistaken, because I'm real bad with recalling dates and phone numbers and stuff like that. I think it was 2008.
Yeah, yeah. So that's about right, because Roger Burgess was patient number 37, and
Okay.
he was in late '05. So that makes good sense.
Okay.
And so your journey was, obviously you were sick. You had ischemic cardiomyopathy, right? You
Correct.
had a buildup of plaque in the arteries, and that led to the heart attack. And did your ejection fraction, have you had it measured recently? Do you know what volume of blood your heart is pumping with each
Yeah,
heart?
it's in the low 40s right now.
Okay.
And
Wow.
and when I had gotten into a bad situation, it was in the low 20s.
Wow. That's wild.
There is a little guy living in there going all the way back to Maui, because the physician that was taking care of me in Maui had a stent put in that's been in there. I think it helps me make long distance calls, but that's about it.
Yeah. Well, I know heart patients have a whole journey that they go through,
Right.
uh, you know, additional procedures and the like. Do you want to share, how many additional procedures you've had since your stem cell procedure? I know you went in for open heart surgery, right? At
Right.
one point.
The open heart surgery, I kind of look at as a negative because I didn't expect it, and they called it an emergency open heart. And one of the reasons for that is because of Hurricane Irma, which is now 7 years plus ago, basically destroyed my home. And we decided to move up here to North Carolina, which I'm outside of Raleigh.
Yeah.
And so my connection to the people in regard to my procedure with stem cells was now X amount of miles away, and it wasn't that next door kind of a thing. And
Right.
all of a sudden I started not feeling good, very weak, just not right.
Yeah.
And I got rushed in for open heart surgery,
Right.
and it was supposed to be quintuple, and it ended up being quadruple.
Yeah.
They couldn't reach the lower arteries on the bottom of my heart, so those weren't touched. The procedure itself was quite easy. I literally woke up whatever X amount of hours later, of course, tubed up, which I didn't like, but the healing process was the hardest. The surgery itself, from what I understand, went great. The surgeon did do something for me, which I thought was really great, because I said to him, I will search you out if you make the scar crooked. And he kind of went, what do you mean? I said, my OCD will kick in. I want the scar to be perfectly, and he did artwork. So I didn't have to hunt him down. The healing process was easy, except for the delicate healing process of what they do to your rib cage. That made it difficult. With the big heart they give you to hold when you cough or sneeze, and bending and moving. That was the most difficult part, getting through that over months. If I was in a situation where I could have gone, no, I'm not going to do it, I'm going to go and have stem cells again, I would have chose that, because I know what it did for me for over 10 years. And I never stopped my regular lifestyle. And one of the major things that I do with my life, or did, is as a scuba diving instructor, outside of doing what I do for a living in the music industry, I never stopped either. I continued and never had a problem. I put it upon myself to be a little bit more careful with my depth. And I started diving, instead of going 4 atmospheres, I would go basically 3 atmospheres. So 60 feet, give or take, was the maximum. And that's always more fun anyway, because that's where the light is, and that's where the life still is. And there's no reason, unless it's a wreck dive, to go to 120 plus feet.
Yeah.
So I continued that while I traveled. And there was even a period of time when I was out with Roberta Flack for many, many years. I would have a road case that wasn't musical instruments. It was my dive gear. So when I'd end up saying, I'd have my dive gear with me and I'd go diving on days off. So the easiest thing I can say overall to this process is, one, I'm still here. Two, it works. Three, I'm proof. It's a very simple fact. Otherwise, I would either be in the ground somewhere or in an urn somewhere or just thrown out into a field wherever people go when they die. But I didn't. And I just got better and I got stronger. I paid attention to my health situation and what I eat. And of course, we all get sloppy sometimes and eat too many tacos. But I'm doing 100% great and literally don't have a complaint. If I was put into a situation where, we think you need another stem cell procedure tomorrow afternoon at 2:00, I would be, okay, not afraid and no hesitation whatsoever.
Right. Well, that's what we have to, I mean, that, you've been very helpful in terms of defining, how it really gave you an extra 11 years before that heart surgery that you said, I think I'd rather do adult stem cell therapy rather than heart surgery.
Correct.
It gave you another 10 years before you actually had a open heart surgery. That really defines really well, I think, the efficacy. We saw in Roger Burgeson's case again, 13 and a half years of additional family love and life from one ACP treatment. In your case, 10 years and of course we see this in vascular dementia with Mrs. Lamb. She had regained her quality of life, regained her life from one VesCELL treatment as a treatment of vascular dementia. So, one of the study areas that is, of course, all the rage today is longevity, using adult stem cells like VesCELL to improve or maintain the quality of life you have now well into your 80s, because you are 74, you're rocking it. And, why shouldn't you rock it like this for another 10 years, right? So yeah, one of the things that we want to study on a very scientific basis is longevity. And we should get you in to a longevity study so that we'll be sitting here in another 10 years and celebrating that.
True. I kind of laugh at that, not what you said, but at that, because I wish there was a way for us individuals who had decided or have done adult stem cell therapy that the outcome is we wouldn't have to pay tax anymore, so we could have the next amount of years free and clear of all of that BS, because that just sits there no matter how good you're doing. And that's the only obstacle I think that we really have. Otherwise, I kind of don't count and go, gee, I wonder what it's going to be like when I'm 84. Because when I was 64, when I was 54, I'm basically the same now. The only difference of anything that slows me down is not my heart. It is not my respiratory system. It's the accident that I had that did such damage to my knee that now I kind of limp around and have to be real careful with steps. My heart is going, go on, move better, keep going, and still want to find time to go diving and things like that. So my life has stayed good. Awesome. That was the only negative in regard to a car accident, which wasn't my fault, but can't change it. So when it comes to knowing what the stem cell procedure did for me, all I can do is look at people in the face and go, if you think you need it, talk to your physician, do some research about it, and have the dang thing done, because it will keep you who you are.
Well, Florida's come online now, and Krim and I were just down there this week. We've been talking to podiatrists and cardiologists about the procedure have got a very warm reception. And so I think there's going to be lots of opportunity to work together, Howie, because, we want to start a patient seminar. We'd like to feature you, feature Neem, your good friend Neem Melo, of Bistro's restaurant, who Kroom had breakfast with this week.
Oh,
I mean,
cool.
this is,
Cool.
this is extraordinary, right? We've got guys who are, in your case, 74, and I think Neem was number 57, patient number 57. Here you are, 10, 12 years and more later, and you're able to talk about this in a very meaningful way. So that's a very comforting thing when you're when other patients are looking for our patient reference, and they can talk to you, and you can put them at ease. It's it'll be wonderful to work together again in Florida and get going. So
Great.
yeah, really appreciate your time, taking some time today to explain your journey. And I think, we're going to have many opportunities to do this in the future. We should have you back, and we definitely will do that.
Let me put it to you this way. I'm going to interject in regard to what I am doing today with you guys and with all the people that might be listening. It's my duty to do this because I don't want it kept as a secret. I don't want this magical thing floating around in somebody's closet of, oh, this guy had this. No, I want people to know, because here I am, here's how I feel, and I want to talk about it constantly, whether it's face-to-face seminars or on this situation we now call Zoom. If I have to come down there to sit with you guys for a meeting, or people being able to throw their hand up and ask questions and see that this person is real and not just some AI thing. That's what I'm here to do, because not only did I get a second chance, I want folks that need it to get that second chance also. That's my attitude about promoting this, because it's me.
Yeah, no, that's so cool, and it's so fantastic, and it's so heartwarming. And as Kroom said at the outset, we're ethics-based, science-based company that is a breakthrough for the treatment of cardiovascular disease.
Right.
And it's wonderful that you will get on your soapbox and sing the praises of it, because it's very meaningful. And the world does need to understand it, and understanding it from a first-hand perspective is, my light years ahead.
Right.
And especially since it's, the effects that you've enjoyed have persisted as long as they have. Again, I know Neem will be the same. Will say the same thing. And if Roger was with us, Roger would be right beside you guys.
Right besides, right.
Yeah, and so that's really cool. So any closing comments, Kroom, on this?
Can I interject again?
Sure.
Which is what I do, because as we see where the world is going, there's one thing and one place that I'm very interested in regard to stem cells, and that is something that hasn't been touched yet, and I'm trying to find out whom to reach out to, because I want to be the first stem cell recipient to be sent into space, so they can then study my physicality as whether it be a short-term astronaut or whatever. But, and here's a Mr. Howard Lindeman who has undergone stem cell therapy, and now he's going around the world one time or whatever, just out of the atmosphere, and his physicality is 100%, and that hasn't been touched yet.
Right. Cool. Well, I got some ideas there, so I'll ping you on that.
Fantastic. Yeah, that's
simple since we are, I guess, coming close to a close of today, my simple thing to both of you and whoever is listening, I am here for you. I am here for everybody. And don't hesitate to go, hey, we're going to do this again tomorrow. It is no inconvenience whatsoever. It is my job because I've learned how to smile about it. And I have a little cliche that I use all the time, and that is, if you can't wake up with a smile on your face, sleep with a hanger in your mouth. It's
Right,
as
Howie.
simple as that.
Howie, thank you so much for being with us. We're very grateful. And so now I think if it's okay with you guys, we'll go back to the deck. I'd like to now go through our science. I'm just going to very quickly channel our chief medical officer. These are slides that we've gone through several times. I've added logos for our investigational sites. We're going to continue to reinforce our clinical evidence around 7 studies of 318 subjects published now in 11 peer-reviewed publications. We have a unique mechanism of action. And as I was talking to Neem yesterday, I had an incredibly inspirational breakfast. He was saying, your blood is the medicine. And it is such a neat way to think about it. And in fact, what VesCELL does is obviously your stem cells from your blood draw, recultured to have certain functions, to find the area of ischemia, to embed, to release growth factor, reduce inflammation, generate new blood vessels. And that really is the source of healing. Fraser went through our mechanism of action. We won't go through all that, but it's fascinating, and we'll cover that more in detail next time, exactly as how the chemistry works. The applications of ACP and NCP, cardiac disease, critical ischemia, and wound healing. And then NCP-01, we talked about our AI brain interfaces. In other words, when a computer chip is planted in your brain, like with Neuralink, where you can control a cursor with your thoughts or control a limb or anything else coming down the pipe, the fidelity might erode over time. And so what VesCELL can do is potentially improve or sustain the fidelity of the computer brain influence. So we're very excited about that. We've talked about net new physics, and so we're on the forefront of that, and we've just published on that. We're looking at dementia, neuropathic pain, orphan disease around syringomyelia, which is something Fraser's interested in, and then traumatic head injury. These are our studies. You could see they're all open label. I'm going to be focusing just for a second on Schubart on the very far right, N=54, relative severe cardiomyopathy in a moment. The safety data that Fraser walked through is as follows, and I think this is fascinating. This is his exact slide. It's a blood draw. It's an office procedure, avoiding anesthesia, no complications associated with bone marrow harvest. The autologous cells, meaning from your own blood, meaning there are no contaminants, no pathogens. There's no ethical concerns with fetal tissue, and there's no risk of, as Fraser says, transmissible spongiform encephalopathy, which is essentially mad cow's disease, no risk to medical providers. So these are some of the safety data that's been gleaned from our prior studies. And then Howie, I think this gets a little bit to your data point, as an N of 1. Here we have an N of 54, where this was, I think, some of the most compelling data as it relates to change of left ventricular ejection fraction. And so you'll see from all patients at 4 months, all patients at 12 months, an improvement, all the way down to non-ischemic heart failure at 12 months of this 14% lift and LVEF, which is a 47% increase. And I think this is where, how you were an N of 1, you might have felt something over the weeks and months after your therapy, but you're physically seeing change in blood flow where you can feel that in your body and in your energy level. And maybe, Howie, since you're here with us, does this data match with your experience?
As far as I know, yes. Very simple, yes. I don't know the physical attributes of more testing from a cardiologist or whatever at the moment, except a simple thing is when I do have an appointment and they do see me, whether it be with a EKG or whatever, the comment is always, oh, we'll see you in another 3 or 6 months. And instead of, oh yeah, tomorrow afternoon, what we have to do, it's always, oh yeah, go do what you got to do. And
Nice.
that to me is a plus because that's my body telling their technical body, yeah, I'm doing fine. And that's why I said, yeah, I'm still around and I'm living on aftermarket parts, so I'm doing great.
And I think Howie, you were treated by Dr. Supachai, right? In Dr. Supachai in Thailand.
No, that was Neem.
Okay.
Team did.
Okay. Okay. I thought because then he's part of that of Dr. Supachai's study, his
Right. And that
results.
was, I think that was early on because as far as I remember, Neem was prior to me.
Okay.
And because he had found out about this particular procedure or science in from Thailand, and
Yes.
that's where he went to have it done
Right.
Okay.
Where was your procedure done?
in Florida.
Okay.
In part of it was done in Naples, and then the important part of transferring the cultivated stem cells was done in the Dominican Republic.
Okay. Got it.
Okay, excellent. So I'll just caveat this is phase 1 and phase 2. This is actually phase 1 study data in a 54. It is statistically significant and it's suggestive now to continue to pursue our phase 2 and phase 3 clinical studies going forward. Investigational therapy that is not yet FDA approved. So now quickly on the burden of CLI. We've shared this data as well before. This is phase 2 study data, safety and efficacy of ACP01 and no option CLI patients, phase 2 open label randomized study of 20 patients, where the amputation and death within 12 months for ACP01 was 4.8%, and for each, placebo is 5% for each. And that really is in alignment with the US Medicare study. So directionally, that was suggestive that our phase 2 data was good and that we would want to move forward with phase 3 studies. These are test results and clinical outcomes showing one patient with wound healing 4 weeks after treatment. And then this was a presentation at the Society of Vascular Surgeons and in Toronto. I believe this was 2 years ago. Thomas, you can keep me honest here. Where
Yeah.
12 patients. Yeah, okay.
This is the 41st. This is the data that was presented to the 41st meeting of vascular surgeons in Kelowna, BC, by the University of Toronto and the University of British Columbia jointly. And it's their data at a 4.5 year mark, which is got to be compared to the 5-year mortality rate of patients suffering from this disease, critical limb ischemia, where 50% of patients who are no option critical limb ischemia patients are dead within 5 years. Compare that to this data, which is that 83% of patients treated with VesCELL saved their limb from amputation and experienced healing of ulcers and cessation of pain. So this was blinded data at the time, which was unblinded and following our phase 2 results. And what's interesting about this is that the patients, 11 of 12, the 83% of patients, were those patients who received VesCELL.
Okay, thank you.
Yeah,
all right. Great.
Very, very significant.
Yeah. Okay, so this is our clinical platform. Future phase 1, 2, and 3 trials coming up. I will just keep cooking since we're a little bit over time here. Part of as we shift into a quick discussion on our care model, there are 3 main steps to our patient journey. Number 1 is assessing patient qualification. So where does a patient fall in their disease state, in their needs, and their care? Are they an appropriate candidate or not for VesCELL? Number 2 pillar is personalizing the intervention. That's where we're culturing the cells, but also talking about surround sound care program. In other words, there's still risk of Western diet, still risk of recency, going back to the bad habits, and then ongoing monitoring of care is the third, and gathering that data as patients go in their journey. We like to recognize the person inside the patient, and that's why we love to have you here. And we can break that down into a couple of things. One is being really clear at what we do. Second, what we need to know, our educational mission, and 3, what is our ethical mission? Really about the soul, what we believe. And those 3 things really come to life in our conversations, Howie, with you, and frankly with Neem yesterday. Very much lean towards a spiritual conversation as he was given a second chance. And he'll be on the webinar, I think sooner rather than later. All adoption comes down to an agreement between, your clinician and the patient, agreeing that VesCELL is right for you. And we talk a little bit about what is happening if you're still within the sick care system. And I'm coming out of Merck, which was a cardiovascular leader in the 90s, and we really were at the forefront of ACE inhibitors and cholesterol reducers and beta blockers, and these were foundational, and they still are. They are really important with lots of clinical evidence to care. But there is an issue called adherence, which is compliance and persistency, where 75% of people really just stop taking their medication. And even as my father had a heart attack in January of this year, he is back enjoying his scrapple and his bacon and his breakfast sausage 6 weeks later. And I was like, Dad, you got to give this stuff up. Like, don't you remember what it was like having incredible pain and going down to the ER? But his medications are paramount and important for him. But, it's the sausage, Dad.
Yeah.
If you're on. Our mission is also about being clear with patients to understand your disease has a name. You can understand it in terms of its symptoms, its consequences, the timing to onset of complications, the cause of your disease, and the controllability. And in the controllability, and this it kind of gets back actually to what the Florida legislation is that we need to be clear on all the options you have, working with your healthcare provider so you really understand everything you can do. And now, instead of being a no option person, you have another option to consider if that works for you and your journey in the right.
May I ask a question?
Sir, please, by all means.
When we say Florida has, now that the doors are open in the state of Florida for this procedure, are other states looking and want to follow suit?
Yes.
Yeah.
There's about a dozen states that are moving legislation at this time, with Utah being the next closest to Florida, with legislation that permits the use of allogeneic stem cells. You can use a donor stem cell in Utah, but they neglected to include autologous, the patient's own stem cell. But we're definitely, we have our finger on the pulse of this, and we'll be moving forward in each of these states as it becomes available. Additionally to that is other jurisdictions like Canada, for example, where patients can be treated under a special access program, or in Japan, South Korea. We're similar to Florida. They have a little bit of a twist on it, but as long as the company's gone through a phase 2, has demonstrated safety and preliminary efficacy in phase 2, then the patients can be treated for various conditions in Japan and South Korea. So there's an opportunity to open up those markets too. But obviously Florida, being Florida and so close to our production facility, we are going to get traction in Florida very quickly this year and blow the doors off it next year.
All we can do is move ahead, bang ahead, and make sure it all works.
We're hard at work. So we talked a little bit about, I know we're really coming up on time. We've talked about pain as a common denominator for lots of our indications. Many people, and if you've ever worked in the pain care space, you start off being strong and tough and resilient, but eventually chronic pain, especially if it's anywhere north of 5 out of 10, really wears you down, and you become enduring and overwhelmed, and almost it's hard for you to function, right? If you're a level 10 pain, and I think anybody with dental pain or heart pain or angina knows that, work always invite the caregiver into the process, and we want that caregiver to be there with anyone who's suffering. And the point of this is really we are listening to patients, how they can make good decisions in the context of their family, with their caregiver present, responsible decisions, knowing that they're suffering. As we talked, we're also interested in net new physics, right? So Neuralink is coming on with at least 10 other companies that allow you to have really life-changing brain-computer interfaces. We're part of this movement. Keep going. Then for critical limb ischemia, just, there are really two things. So when we're talking to podiatrists and cardiologists, there are two things that have to happen in a done-for-you setting, which is a clinician needs to take the initial blood draw. That goes off to our FDA-approved clinic. 7 days later, the cell's recultured. The physician is re-injecting, in this case, into the calf muscles and into the top of the foot, which is something we think most clinicians can do if you have a blood draw station. And frankly, many of the podiatrists we were talking to, even in Florida this week, also conduct surgery. So they felt comfortable that they could deliver the therapy in a simple and safe manner. We have a care workflow, which is patients are referred to us by a physician, or the physician could be treating themselves. We have initial contact where we are qualifying that person. We need to ask for your diagnostics, your MRIs, other things like that. If we need net new diagnostics, we'll get that, but we'll have our trained clinicians review your file. You'll be determined whether you are or are not a candidate. If you are, you'll move forward with learning about scheduling therapy, where you would need to go, so travel, and then payment. Payment and access is paramount. We're very focused on that issue, working very hard with banks to get low monthly payments. Also, the therapy convertible debentures is a way to pay out of pocket and reserve your treatment and secure a 6% interest rate. And Thomas, you'll fill in some color there. And then finally, the 501c3, which is our nonprofit that will be funded. So for patients that can afford for themselves, if they're of means, and yet if they choose to potentially buy a second therapy for someone in need, we encourage them to do that as we sort of go through our hard work to secure access. Then also as we work through our phase 3 trials and then through the regular payer reimbursement channels in the US and around the world.
Well,
If I may ask a question as we roll into the financial side of things, I've been asked, and I also wonder, now that we are moving forward with all of the specifications, with all of the legalities, is there any talk or any possibility of whether it be Medicare or Medicaid at some point wanting to join in on this and help people?
Great question. What we need to do, Howie, is we need to prove to the insurance companies that they will make more money by in the next 12 months by treating patients with VesCELL today as compared to the standard of care. And the way we can do that and how we are doing that is by tracking each of the patients over a 12-month period. And we will do this with not only for the data of, obviously we're interested in the patient's welfare, but the data serves two purposes. It serves the purpose of getting FDA approval earlier, and it serves the purpose of proving to the insurance companies and the payors that it is more economical to treat with VesCELL than it is to do open heart surgery and other modalities of care. And so, yes, the short answer is yes. But the detail is that it will take some time, but we're capturing the data to do so. And I just wanted to commend you, Kroom, on obtaining the financing package that we announced yesterday for patients. You know, that goes a long way to deal with people in the way that they like to be dealt with. In other words, you know, we all get pretty comfortable with making a car loan payment or getting on a regular monthly payment plan, and this is really what we've accomplished and announced yesterday. In terms of the therapy convertible debentures, Howie, what we've got is if it's a high net worth individual, then we can sell them a therapy convertible debenture, which means that they pay us $37,000 US. We pay them 6% interest on their cash while we put it to work. And what they're buying essentially is certainty of treatment and their place in line. So far we've sold 23 of them, and we have that gets us to patient number 521. So the next patient that comes in line that wants to buy a convertible debenture becomes patient number 522, and so on. It also helps us schedule physician time, because the physicians are, as you know, very busy people. So by selling the convertible debentures forward, we're able to slot production time, schedule the blood draw, and schedule the physician time in the most succinct and logical way. And so that's an innovation that we have come up with at Hemostemix, which enables us to get plan and get forward in terms of sales. Last piece on that is that we say to the high net worth individual, buy two, buy one for yourself and buy one for someone like someone who needs a treatment, someone who can't afford a treatment. So buy two, donate one to a 501c3 that is established by Dr. Henderson, our Chief Medical Officer, and that therapy will be donated, passed on to an individual who can't afford one, but who needs it. And I think about, a mom, for example, who has, 3 kids or 4 children, who has got ischemic cardiomyopathy because she inherited it from her mom or her dad, and and needs a treatment. And we think about this in those terms. So that's the therapy convertible debenture piece, and it's the C piece. And if you think about it, for the high net worth individual, they get a tax receipt for the therapy that they donate to the 501c3. So they, as a charitable gift. And that really helps move the company forward, helps 2 patients instead of 1, and is really what we're all about.
Cool. I've told people, in short, to cover exactly what you're talking about, but I brought it down to the street, and I've simply said, don't buy the car. Take care of yourself first.
Right. Exactly.
Awesome. Okay, everyone, we're at 1:03. Let me just wrap here very quickly. We've talked a lot about our complete care program, diagnostic workup, full 360 wellness and monitoring. We've covered our access solutions that we're working hard on. We have our first bank, which is exciting, Thomas. And then just reach out to us for patients or physicians who would like to learn more about therapy. We'd love to schedule time with you. Please reach out to me directly. For medical affairs, please reach out to Dr. Henderson. And then for anything at all, reach out to Thomas here, who is an incredible advocate across all of our solution sets. We do VesCELL Health Talks every week. So we would love to encourage everyone to come back. Thank you for being part of our community. We probably won't have much time or any time for questions today. We'll pause for a second and take a few. But I think everybody has to scurry on to their next meeting or appointment. But please come back every Thursday. And we're grateful here. And Howie, thank you so much. It just makes this so meaningful and all worthwhile to have you here today. So thank you
very much. I'm here for you guys, and I'm here for all of the people that are listening and wondering. So don't even hesitate.
Thank you. Thomas, anything else?
I think we've had a fantastic week in Florida, a very warm reception in both cardiology and podiatry. Lots of news to follow there with our follow-up. And I think you can see the momentum clearly in the weekly webinars, but we're also seeing now the momentum in the stock. HEM trades on the TSXV, or in the US on the QB market as HMTXF, and for our European friends in Frankfurt as a 2VF0. So, we are still undervalued, but so be it. And it just represents a very significant opportunity if you're a risk investor. Management and the board have more than, I believe it's now about $11.6 million invested since March of 2020. As an investor, you're joining a team that is sophisticated and that is leading the way with their own investment.
Fantastic. Thank you, Thomas. There's no questions, but there's a nice compliment, and we're grateful for that. And I'll just read it because I think it captures the spirit of what we're trying to achieve. Great webinar and keeping your investors, doctors, healthcare providers, and patients informed in this groundbreaking and life-changing stem cell therapy Excited to be part of this incredible journey. So thank you for those kind words. And that is it. No other Q&A. There, Thomas. Thank you, Howie. Thank you.
Likewise, wishing everyone a fantastic long weekend. Be safe and enjoy the family, and we'll see you next week.
You got it. Absolutely. Thank you, guys.